The government of Ghana, just like all other countries, has been very interested in procuring ample personal protective equipment and other essential items for health workers in the fight against COVID-19. That notwithstanding, health workers have repeatedly called for more of these PPE to help in the discharge of their duties efficiently and to keep them safe. In response to this call, the Ghanaian mission in Beijing, China, with assistance by Tianyun Manganese Company, a Chinese firm, has donated ventilators, surgical nose masks, gun thermometers, isolation gowns, medical shoe cover, disinfectants and wipes amounting to $400,000 to aid in combating the coronavirus.
Today we are here to present through our ministry to the Ministry of Health items donated by Chinese companies that do business with Ghana. Majority of these have been donated by TMI, the Tianyun Manganese Company. And so I'm here today on behalf of my ambassador, His Excellency Edward Boateng, and the entire team at the Beijing mission to make the presentation to our ministry and for onward transmission to the health ministry. We believe that this will go a long way in assisting government's efforts aimed at fighting COVID-19.
Receiving the items on behalf of the Ministry of Health, a Deputy Minister of Health, Dr. Bernardo Koboy, urged citizens to stop resisting the siting of isolation centers in their neighborhoods.
I have witnessed communities who say don't bring an isolation center here. But if you are saying they should not bring an isolation center to your town, when your relatives get COVID-19, should we banish them from Ghana? Or we should, forgive me, slaughter them? That is not the way to go. We as a people must stand and help our own when they are in need. And the best way to show your Ghanaian culture is to make sure that you support initiatives that are meant to save lives. Isolation centers will save our lives.
He called on other benevolent organizations to emulate the gesture and assist government in containing the spread of the virus in the country.
There are three sources for PPEs. Either it's public, that is government, private, as in like McDonald, Despite and the rest did, or through partnerships. And I'm happy that this partnership from our embassy in China has resulted in having these numbers. With partnerships, we can win the war faster and quicker. And so I'll take this opportunity to encourage all NGOs, civil society organizations, all agencies, whether public or private, to come on board so that we can sustain the supply chain and make sure that we protect our health workers and protect ourselves as a people.
Meanwhile, the Deputy Minister for Foreign Affairs and Regional Integration, Charles Owredu, says government will soon decide on a plan to repatriate Ghanaians abroad who are yearning to return home.
What we've asked our missions abroad to do is that they need to get us the data. How many Ghanaians do we have, who are willing to come? And even with that, we need to have some category, because some are saying that they want to pay on their own. Some are also saying that the employers are ready to charter an aircraft, to get them in. All they only want from us is to open the borders to allow them, to land. And the others, of course, who also don't have what it takes. They don't have the means to also get back. So once we get this data, we would make that decision based on what is in that data. And we are yet to do that. We gave them a deadline of yesterday. So as at yesterday in the evening, I guess that we've received all the data that we have. So we are processing the data for onward submission to His Excellency the President.
Also, a ranking member on Foreign Affairs Committee in Parliament, Samuel Okujetua-Blakwa, says government should consider negotiating with countries that evacuate their citizens from Ghana to bring Ghanaians within their jurisdictions back home.
Who continue to evacuate their nationals out of Ghana? Their flights come in empty. Can our government consider high-level bilateral negotiations so that, for example, if the United Kingdom decides to embark on a fifth evacuation, they've done 4 evacuations so far, all their flights came in empty. I don't understand why we let them do that. So, by virtue of we agreeing to open our airport, let's also get something from it. So, instead of bringing your flight empty, let us negotiate with you that you will bring in our nationals. Of course, we all know evacuations follow WHO protocols. They will be screened, they will be tested. When they are negative, they come on board, just as we do for the flight crew who come in. We make sure that their medical reports show that they have tested negative. When they come, we screen them and all of that. Let's do that for our own. It makes sense to me, so that it will even ease the financial burden. That is, if government decided, to foot part of the bill or the entire bill for those who are stranded, especially vulnerable groups. So let us not miss that window of opportunity.
Reporting from the Ministry of Foreign Affairs and Regional Integration, I'm Ni Ayukwe Okain for Citi News.